Hello, everyone. It's Wednesday, November the 18th. Before I get into all the detail about these great West Virginians we've lost and everything, I want to address something that is circulating around, and I don't really know if it's prompted by those that are political wannabes that are feeding, people information that's incorrect beyond belief, or I don't know if it's coming from our legislature or coming from the media or where it's coming from. But let me make one thing absolutely perfectly clear. Jim Justice does not want to shut anything down in this state. And the other thing that you need to know, and know just point blank, is just this. What have I shut down? What have I shut down since the initial shutdown, in which we all had to do all across this nation? What have I done? What have I shut down? The bars in Mon County, and it was a good move. But other than that, what has been shut down? Nothing. Zero. So from the standpoint of this, maybe the media are saying, are we shutting everything down today and whatever like that? Absolutely get that out of your mind. Please get that out of your mind. Now the other thing, from the standpoint of people feeding you, you know what, and them telling you, well, he's telling you that it's mandatory to wear your mask. The next thing, they're going to take your guns. The next thing, they're going to shut down our businesses and everything. Please tell them to stop that nonsense. It is nonsense. That's all there is to it. Now, let me just be as cold and as truthful as I know how to be, just like I am every time I come here with you. And it's just this. We got a real problem all across our land. Not just in West Virginia, but all across our land in our United States of America. It is a real problem, and it is running like wild right now. Now, with all that, it's hard to tell where we're going to end up. Absolutely, if we want to keep our businesses open, to keep our schools open, to absolutely be the guiding light that West Virginia has been on and on. What can we do until we get to that vaccine? The only other thing that we can do is wear a mask. And if that's too much for me to ask of you to wear your mask, it's just going to be too much. That's all there is to it. Because absolutely you need to do that. You need to do that to protect your neighbor. If you don't believe in it whatsoever, it is not just affecting you. Absolutely, could possibly be the difference in just saying, well, if I'm drunk, then I ought to be allowed to drive. Or if I couldn't possibly see or read, I ought to be able to go just as fast as I want to go at any time on any highway across this state. You see, whether we like it or not like it, we are a nation of law in this country. And we do that not to restrict our civil liberties in any way or our rights, but we only to be able to protect us as a nation, to protect us. Now, there are those that are out there that are saying, this isn't real. This isn't real at all. I don't believe this is not real. And really and truly, you could just let us do whatever we wanted to do, and you could be South Dakota. Look it up. Look it up. Look up what's happening in South and North Dakota. Look it up. We don't want to be South and North Dakota. I'm trying with all in me to only go one teeny step, and that's wear your mask. There's not a thread of me anywhere that has a thought today to shut anything down. Stop this nonsense, whether it be whomever it may be, your leaders, whether they be in my office or in the legislature, or whether they be the political wannabes, whether it be the barbershop, whether it be the media. Stop the nonsense. All we're trying to deal with right here is to try to get us to that vaccine. Wear your mask. That's all we're asking. That's all in the world we're asking. That's it. Now, like I said just a second ago, this thing is going across America in a big time, really tough way. Let me just go to something here. In the past day alone, in the United States of America, we lost 1,707 people. What does it take to get our attention? We don't want to close anything. Nobody does. I'm the very person that brought us through the economics of this entire deal. I'm the very person that brought you a surplus in the last year when we had a pandemic and had to move the income tax filing date. I'm the very person that now has the unemployment rate in the state of West Virginia at 6.4% and going down all the time. Do you honestly think that very person would want to shut something down? Stop it. Stop this stuff. Now, in the United States, we lost 1,707 people. Since Monday, we lost 27 more great West Virginians. You know, in the past week in the United States, we lost 8,091 people. Do you know what that is? That's more deaths in 1 week than we lost in all the war on terror. Think of the troops and their ungodly great sacrifice. Think of all that they did. We have lost more people in a week than we lost in all the years on the war on terror. Now, it's a problem. We deal with problems, don't we? Now, it doesn't mean that we go out and start screaming the sky is falling or justice is going to do this or he's going to put a mandate on, he's going to take my guns, or he's going to stop us from driving an automobile, or he's going to absolutely shut down our businesses. That is hogwash. Stop the hogwash. That's all there is to it. Stand up. If you want to stand up, West Virginia, if you want to stand up for our president, who stood right arm in arm with him forever? It was me. If you want to stand up for what we think is right, no low taxes, or right to life, or our Second Amendment, you're looking at it. Stop the hogwash. That's just all we got to do. Now, of the 27 people, again, with all the respect that I can possibly have, our 586th death is an 84-year-old female from Boone County. Our 587th death, a 59-year-old male from Kanawha County. Our 588th death, a 79-year-old female from Kanawha County. Our 589th death, a 68-year-old female from Barber County. Our 590th death, a 72-year-old male from Fayette County. Our 551st death, an 86-year-old male from Ohio County. Our 592nd death, an 88-year-old female from Ohio County. Our 593rd death, a 75-year-old female from Jefferson County. Our 594th death, a 68-year-old male from Hancock County. Our 595th death is an 80-year-old male from Putnam County. Our 596th death, a 69-year-old female from Putnam County. Our 597th death, an 89-year-old female from Putnam County. Our 589th death, a 68-year-old male from Boone County. Our 599th death, an 86-year-old female from Cabell County. The 600th death in West Virginia is a 44-year-old male from Mingo County. Our 601st death is a 78-year-old female from Mercer County. Our 602nd death, a 90-year-old female from Brooke County. Our 603rd death, a 68-year-old male from Wyoming County. Our Our 604th death, a 74-year-old female from Kanawha County. Our 605th death, a 72-year-old female from Roane County. Our 606th death, a 76-year-old male from Nicholas County. Our 607th death, an 81-year-old female from Wood County. Our 608th death, an 86-year-old male from Harrison County. Our 609th death, a 62-year-old male from Wayne County. Our 610th death, a 92-year-old male from Jefferson County. Our 611th death, a 76-year-old male from Logan County. Our 612th death in West Virginia is a 94-year-old male from Jefferson County. You know, I was asked just a little while ago, you know, if my continued pleads to get you to social distance and wear a mask and go get tested, you know, they fell on a lot of deaf ears for a while. And then all of a sudden we began to hear and we began to go get tested. It will bear fruit at some point in time. For those that still absolutely believe that they shouldn't wear a mask and are not going to wear a mask and they're in defiance of that and everything, I wish to goodness that you would really reconsider. For those that have raised the issue with me that says, you know, stop shutting our state down, I don't know how to answer it. For crying out loud, what have I shut down? Nothing. You know, absolutely not anything since the bars in Mon County. Now, should we absolutely be really restrictive about what we do in regard to sports? You're dadgum right. You know, our kids need to have the right and the ability to go to school, first and foremost. Now, we all love sports, and nobody could love it more than me. But at the end of the day, sports have got to take a back seat to what's going on here. Without any question, all I ask of you is just this. I wish that you could reconsider from the standpoint of wearing your mask. I salute how we have really stepped it up. Since I issued that order the other day and took out the social distancing, we have gotten lots better about in our public spaces wearing masks. You got to do it. You just have to do it. Do we have to do it forever? Well, of course not. Could it affect somebody other than yourself? Well, of course it could. You know, that's exactly why that it is absolutely mandatory that you do that. Because it's not just affecting you, it's affecting others. Now, you know, then there could be somebody could say, well, you know, I can't breathe. Well, if you can't breathe, then you don't have to wear a mask. You know, absolutely, you know, the argument that this is going to lead to more, you know, restrictions or whatever like that, this isn't going to lead to more restrictions. What's going to lead us to more restrictions is only one thing. I said this to the legislature the other day. God forbid, but what if we are faced with a situation tomorrow, and it won't happen tomorrow at all, don't get me wrong, but what if we're faced with a situation in the months ahead that all of a sudden in the state of West Virginia we start losing 300 or 500 people a day? I mean, what if that, as bizarre as it may sound, what if something like that happens? Well, you know what? Not our legislature nor our governor will really be making decisions then, because the outcry of the people will be crying so loudly to stop things that you won't need input from me or the legislature. We're in a pandemic and people are dying all over our country like flies right now. Now, for those that believe, well, they die anyway, I mean, I can't get through that argument with somebody. It's just not even fathomable that they could think that now. Every health expert across this country is saying exactly the same thing. We have to wear our masks now. We can be really, really thankful to our president in that he fast-tracked this vaccine, and we hope and pray that it's going to get to us and get to us the faster, the better. But for now, the only ammunition in the gun, the only thing you got is the mask. Testing is great, but you got to wear the mask. Now, in the state of West Virginia right now, you have 429 people hospitalized in West Virginia. It is jumping very, very quickly. You have 126 people in the ICU units. We still have capacity. But if we don't slow this down, how long are we going to have capacity? We tested yesterday in the state of West Virginia 23,000 people. 23,040 were tested yesterday. Now, first of all, I don't know exactly what that cost, but I would think that it cost in excess of $2 million. That's $2 million of our CARES money in our testing yesterday. Imagine what this is going to add up to. Our effective reproduction numbers at 1.14. It's still probably right in about the middle of all the states. We now have 3 counties in the red and 15 counties in the orange. The red are Marshall, Mineral, and Jackson. In the orange, we have Hancock, Brooke, Ohio, Morgan, Berkeley, Jefferson, Hardy, Randolph, Barber, Wood, Mason, Putnam, Cabell, Wayne, and Boone. All across this state. You know, now I've just been, apprised of the fact that the total number of testing that I just said that from the notes that I had, that we had 23,000 tested yesterday in the state of West Virginia. That number's an error. We're going to try to get you a correct number on that in just a second. Our daily positivity rate in the last day was at 5.66. And our cumulative positive is at 3.35. Actually, that number, and again, being completely transparent and trying to be completely accurate, yesterday we tested 12,000 people in West Virginia. And that's great too. That's a great big number too. As I said just a few minutes ago, and I can't for the life of me understand why this doesn't resonate with every single person around us. We lost 1,707 people yesterday in the United States of America. We are right at 250,000 people that we've lost with this dreaded pandemic. There was 161,934 new cases in the past 24 hours in our country. We've now reached 11.3 million cases in the United States of America. All these numbers validated by Johns Hopkins. I've been through the face covering stuff until I can't talk about it anymore. I urge everyone to please wear their mask when they go into out into public buildings. It won't last forever. I'm not asking you to do something that's going to go on the rest of your life. I'm asking you to do something that may go on just for another month or two, and then we'll be able to go. We hope and pray anyway. We have printable signs available if your business needs them, and they are available on our website here as well. Our testing before the holidays, we urge you to be tested before the holidays. We have extended the school being out from Thanksgiving Day to the following Thursday. We're trying to go back. We'll be going back for, I think, 11 days before the Christmas break. You know, there's surely argument on the table as to whether or not we should go back at all, but I do believe that we've got to contend with everything from special needs, from the education of our kids, from the standpoint of daycare, all the different components that we've got to factor into this policy. And from right now, and at this time, we're still letting the locals, the counties, make decisions on their own. But at the same time, you know, it's my belief that we should go back to school. The free testing, you've got that. It's up on your website. The drive-through pharmacy testing's there. We have 22 outbreaks in our school systems with 110 confirmed cases. Really, to be perfectly honest, that number's great. You know, compared to all across this land, really and truly, we're doing a good job in our schools. Our long-term care facilities, we have 82 outbreaks. In our churches, we have 20 outbreaks in 13 counties. It's Cabell, Fayette, Hardy, Jefferson, Kanawha, Mingo, Monroe, Preston, Raleigh, Taylor, Tyler, Wood, and Wyoming counties. And these outbreaks account for a total of 280 cases. I go back to the same thing I've said over and over. At church, wear your mask. At church, a pew in between you, social distancing. Please, please, please try with all in you to recognize if you happen to be an elderly person and you want to go for your church services, go. Try to go with every one of these guidelines. They'll protect you and protect others. And not only that, right behind all that and everything, if you can get your services online and you choose to not go at this point in time, it'd probably be wise. Now, the other thing is just this. I urge everybody. You've seen the name or heard the names of the people that I've read and everything, and it's easy that this terrible killer attacks the elderly more than any. And so if you can run to the grocery store and get groceries or whatever it may be, or help any person of age, you know, that is one of our seniors, please do so. Please do so. It'd really be very, very helpful. Now, let me just tell you how this can run through anything. I said just the other day, Cecil Patterson called. He's a great county commissioner and a great man in McDowell County. He called and said, we got a real problem. You know, we got a real problem. We've got, you know, I don't know what it was, but maybe 10 people at that time that are active active inmates that have tested positive, and maybe 6 or 8 staff, and we got to move because we got a problem. We got an out-and-out outbreak on our hands down here. Today there are 260 active inmate cases at the Stevens Correctional Center in McDowell County. There are 30 active cases among the Stevens staff. Outside of Stevens, there are 8 active inmate cases and 32 active staff cases all across the state. There are 8 active inmate cases across our state, and there's 260 in one facility in McDowell County. It goes through us like a knife through butter. It absolutely goes through us at a speed that is very, very difficult to stop. I have told you over and over, West Virginia, you're the oldest. You're positioned with border states all the way around you. You absolutely have the most sickness of any state in the nation. This can go through us even worse than it is today. Flu vaccines are available. If you can get your flu shot, please try to do so. They're available for everyone that's 6 months in age or older. as far as back to the dollars from the CARES Act that are going out and everything, we're at 184,029,674 dollars that have been awarded to our cities and our counties. And I know that's been a lifeline for our cities and counties. We want them to continue to apply as they've been doing, and we'll continue to try to pump the money out. I'll wrap up by just saying just this, and just to restate, quit scaring people. I mean, whether you're that political wannabe that's riling everybody up and everything and saying your businesses are getting shut down and everything else, or we ought to be like South Dakota or this and that, quit that. Quit scaring people. Whether it be the media or it be whomever, somebody in my office or lawmakers or whatever it may be, quit scaring people. We don't need to shut anything down. We're not going to shut anything down unless this thing continues to get worse and worse and worse. I will protect you, West Virginia, as the best of my abilities. Now, and absolutely with all in me, I do not believe we're going to have to take any drastic steps. Now, did you hear that? I really don't think we're going to have to shut down anything. And God knows I don't want to shut down anything. But we can't with something that we don't have a playbook, we don't know anything about this pandemic, much at all and everything. Absolutely, we cannot take anything off the table. We have got to continue to tweak and adjust and keep moving as we go forward. That's what we're going to continue to try to do.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. I will just add to what the governor has said that today in West Virginia, we are averaging more positive cases per day over the last 7 days than we have at any other time during the pandemic. As the governor said, across the United States, we're seeing more people in hospitals, and we are seeing more people in hospitals in West Virginia with COVID. Although, as the governor also said, we still have plenty of capacity, and most of the people in our hospitals or our ICU beds are people that do not have COVID. But we, like other states, understand that we are both seeing increases in the numbers of daily new cases. We're seeing increases in the numbers of people in hospitals, and we can anticipate that 2 to 4 weeks after we see more cases, we will continue to see more hospitalizations. The governor is committed, and I give him tremendous credit, to maintaining our state open for business in every way possible. And that is important to keep our state together. And that's what the plea I heard him talk about this morning was, not to panic and to stay together and understand that we're all pulling the rope in the same direction. And I would say, as we look at our new cases that we've diagnosed over the last week or 2 or 3 weeks, we're seeing a rise in people who are 30 to 49 years old getting COVID infection, and also seeing a rise in people that are 50 to 64 years old. And we know that increases in these populations generally precede increases in older people, because in many ways, these are the ages of children of people that are older and most vulnerable. So from my perspective, from a medical standpoint, and from the governor's perspective, from a business and economic standpoint, we are testing more, which is important. We are working on our contact tracing, and that's important to identify people quickly who are infected. But the single most important thing that we can all do in this time as we are getting the vaccine, which the Pfizer vaccine finished its clinical trial, and it looks very, very good. And the Moderna vaccine also looks very good. So we can anticipate almost certainly that these vaccines will be approved. by the Federal Drug Administration after they look at all the data, but we're very optimistic about that. But in the meantime, to be able to keep our state open, to be able to reduce the number of people in hospitals, to save lives so that we don't reach some of the numbers that some projection sites like the University of Washington site are projecting for deaths in West Virginia or deaths around the country. It's simply enough that we do wear our masks and we do physically distance and we avoid indoor environments that are risky with crowds and with people that may have their masks off. And if we do that as a community and do that well, then we will be able to support this very critical time that we are about to go through in the next month or 2 months. As the vaccine is coming out, as we're getting people immunized, we can't let our guard down. This is a time that we answer the call to save our lives of our vulnerable people, to protect ourselves and to keep our state open, to keep our schools open, to make sure that our children are getting what they need from an education perspective and a structure perspective and getting fed and getting taken care of. And that should be a very high priority for every West Virginian. So as we look forward, that if we stay together and we do the simple things that we know do work very, very powerfully against COVID spread, then we will continue to be the model for other people to follow. And West Virginia, it is on each one of us to answer that call, and I have every confidence that we will do well in this upcoming time. So thank you.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good morning. Several significant operations going on today and over the last couple of days for the National Guard. We continue to support certain nursing homes with applying barriers for COVID prevention and mitigation. A significant number of test lanes continue to go on across the state. We're working with our local health departments and DHHR on a number of significant sanitization missions, the most significant of which will be the Stevens Correction Center, which will take multiple days to work through. We also are conducting a number of deliveries, and over the past 24 hours, our task force sustainment conducted 86 missions in 20 counties, primarily focused on delivering additional testing capability to nursing homes, assisted living facilities, and to our EMS counterparts to make sure that they can test and stay safe as well. I'd like to highlight two last things. One, an individual, Airman First Class Julianne Arnold, member of the 167th Airlift Wing, less than 2 years in the National Guard, studying to be a nurse, is working in one of our counties as a contact tracer and case investigator. As part of her duties, she contacts West Virginians, and particularly vulnerable West Virginians, on a daily basis who have been infected with COVID. On one particular day this past week, after a couple of days of calls to one particular elderly West Virginian, she recognized in the lady's voice that there was some significant distress. She called 911, and that individual was taken care of by local emergency management, taken to the hospital, and put in stable situation. So it's just an example of the people on the front lines, local health departments, National Guard, DHHR, people out there working daily to protect those vulnerable citizens that the governor talks about. And in today's briefing, the morning briefing for the National Guard and DHHR, we were informed by our statistical analytical folks that 42% of our cases have occurred in the last 30 days. That we are now averaging 4 deaths per day at the average age of 77 years of age. So I just ask you on behalf of all those people on the front lines and those people that the governor reads out every day, now for a day average over 77 years of age, it's time for us as West Virginians to step up and do the things we need to do to protect our vulnerable citizens and population. On behalf of the National Guard, I thank you for your efforts and support.
Thank you, General. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. Today we want to talk about notifying your close contacts if you're diagnosed with COVID-19. So if you've been notified that you have COVID-19, we do want you to consider, if you're comfortable, to notify your close contacts. And we are going to post something on our DHHR website today to assist you with this. So if you're comfortable and you've been notified by the lab or your county health department that you have COVID-19, we do want you to start thinking about notifying your close contacts. And those are someone that you've been in contact with for the past 48 hours or the last 2 days. And these include someone that you live at home with, or that you might have spent the night with, or that you've been within 6 feet of, or even if you're wearing a mask, so within 6 feet or within contact more than 15 minutes within a 24-hour period. And that's definition of a close contact. And again, this is on our DHHR website. So you can make a list of those people. You'll still share that with the health department because they will be still notifying you. This does not take away the health department's role in that, but you can get ahead of the game, list those out, notify them so that they can also be self-quarantined for 14 days. After 5 or 7 days, your close contacts will also likely need to be tested for COVID-19. We do also want to remind any essential workforce members or critical infrastructure workers that they may be asked to return to work due to staff shortages. These typically include hospital staff workers, so they might be asked not to stay in isolation for 14 days. But all of this information, our epidemiologists have laid it very nicely out on a form that's on our DHHR website. But we do believe with the heightened number of cases we're seeing that if you've been diagnosed with COVID-19, that will help us get in touch with someone and your loved ones as well. So as the governor mentioned, we do need to stand up, we need to wear our masks, and we need to be more proactive out there. So we are going to have that up there sometime today. Thank you.
Thank you, Dr. Amjad. Secretary Bill Crouch with the West Virginia DHHR is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Nice to join you people again. I have a question for Governor Justice and or General Hoyer. I know that we have more pressing things to worry about right in front of our face. I'm not unaware of what's going on in the state, but coming up in December, and I believe it's December 17th, the federal reauthorization for National Guard troops, which takes care of better health care, a little bit better benefits for them, and also takes a lot of the burden off of the state for those expenses. I believe it's set to expire again. This is a situation that we went through earlier this year. President Trump extended it. There was a lot of talk about it. I haven't heard much about it, and I know we're still a month away. But Governor, are you working already with the administration about pushing that thing out again? And General Hoyer, what is the thought from your standpoint? Thank you.
Yes, sir, Kenny. Our letter went out. Our request has already been sent out to the White House, and I think our general can fill you in a lot better than I. But our request has already gone out, and in addition to that, frankly, I cannot believe. I cannot imagine that they would curtail the funding. Of all the groups, of everyone, to curtail funding to our National Guard, they've just done miraculous work. So, General, fill in, please.
Yes, sir, Governor. Kenny, as Governor pointed out, we did forward our letter through FEMA to the White House. Governor and staff have made additional calls. We are tracking that along with about 15 other states. Our letter is at the highest levels for final consideration, which would extend us through 31 March and then ask for an additional extension beyond that for the actual vaccine support. Worked with the governor and the senior staff, and we have a fallback plan in place to manage a state active duty circumstance if that becomes necessary. But we're hopeful that, as the governor said, that we will get that through expeditiously and take care of the men and women of the National Guard who are on the front lines with our fellow agencies on this effort.
All right, thank you, Kenny. Next to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. Governor, I think it's fair to say that the mask mandate has met with some division and honestly some resistance. Now you spoke a lot. You spoke to a lot of this on Monday, and then again today. Obviously, this is not exclusive to West Virginia. It's going on all over the country, but it's really starting to feel more like we're fighting an ideological cold civil war as well as a pandemic here. And now on Monday, you had said that you don't have the power to make law, but that kind of begs the question of what is the value of an executive order if it cannot or it will not be enforced. Now, to use one of your expressions, if I may, to a degree, it seems as though we're confusing effort for accomplishment here. As you had said, I believe on Monday, 95% of people in West Virginia think that we should be wearing a mask. Science agrees, medicine agrees, education agrees. From a business standpoint, we know it can prevent the need for any possible further shutdowns down the road. It's been irrefutably proven that the mask decreased the spread of the virus. You know, obviously there's some concerns raised, but we know those concerns can be mitigated. So at this point, why not call legislature back into session and let them vote on it? Why not give them the opportunity to step up and do the right thing and do what 95% of the people in West Virginia want? Maybe in my limited understanding, I'm oversimplifying it, but would that not alleviate a lot of the division that we're seeing right now? Thank you.
Matthew, I'll make a stab at a whole bunch of this, but Matthew, we're talking to the legislature. We're doing it, you know, nonstop. From the standpoint of me making this a criminal offense, I can't do that. You know, we absolutely, you know, that's not within the power of the governor. I can, by executive order, mandate wearing masks. I can do that. We need to absolutely know that we've got to, naturally, we've all got to continue to try to find some way to work together. But Matthew, you are correct in the fact that 95% of West Virginians are saying wear the mask. And we do legislate for the masses. You know, I don't think that we'll have to call our legislatures back into session, and who knows, you know, if that's the right decision or not, but I am not opposed to that. I am not opposed to that at all, because at the end of the day, you know, Matthew, I think that our people need to speak up more too. You know, when it really boils right down to it, if we just came in tomorrow and said, look, you know, I've tried with all in me. I am beating my head against the wall. I am doing everything under the sun that I can do. And yet you still have this echoing nonstop. And I don't, by God, I'm not going to wear a mask. That's my civil liberties, you know, this and that and everything else. You know, and I said, okay, just do what you want to do, you know, and don't call me when it all blows. Well, first of all, that's not the responsibility. That's not the action that you want from the governor. And at the end of the day, our people across this land are going to have to speak up and stand up. You know, you can't just sit on the sidelines and know something is affecting your life and endangering your family, And absolutely, I don't want us to pit neighbor against neighbor in any way. But at the same time, we need to let our voices at least heard to our legislatures, to us in the governor's office. We need to absolutely be covered up with calls saying, please, please do the right thing. We've got to wear masks. We have got to do that. If we don't and we just open ourselves up, how many are going to die? You know, there are arguments out there that, well, no more will die. That's absolutely silly beyond belief, and you know that. And absolutely, because you can see it at a prison tomorrow. You can see it at Stevens Correctional Center right now. You know, all of a sudden this enters the door. It will enter the door if you don't have the mask on. It'll enter the door, and when it enters the door, it goes like wildfire. It's not the flu. It's way, way worse than the flu. Every single one of our medical team says, wear the mask. Now, Matthew, no question I'm tired. No question I am busting my ever-loving chops in every way I possibly can to protect you, to ensure the economics, to keep us working, to not shut stuff down, on and on and on and on. And it wears on you. It really wears on you. But Matthew, you are right. In the 95% of the people in this state believe we should today be wearing the mask to try to protect us. It may even be higher than 95. We just need to try to continue to encourage in a positive way. We do not need to pit one against another, to encourage in a positive way for all of us to try to do that. We've got, you know, at 95%, we will have tremendous successes. But if we had 100%, we'd stop this thing. We'd stop it in a lot of ways. But that's the best answer I can give you, Matthew.
All right, thank you, Matthew. Next to Mark Curtis with Next Star Media.
Good afternoon, Governor and cabinet members. I direct this question to the governor as well as our medical professionals on staff. And this is a form of a question I've been asking from time to time at the briefings, but now other states surrounding us are taking specific actions that could affect West Virginia. Governor DeWine ordering the 3-week curfew from 10 p.m. to 5 a.m. And the governor of Pennsylvania saying you can't fly into Pennsylvania unless you won't be allowed to deplane unless you've got the test results that show you were recently tested and that you are negative. Again, one can imagine a scenario where people at bars in Ohio say, well, it's 10 o'clock, it's closing time. Let's drive to Huntington, Parkersburg, or Wheeling and keep drinking and watching college football. And that brings in its own, problems with the drinking, but also the possible spread. And by the same virtue, someone could say, well, instead of flying into Pittsburgh, I'm just going to fly into Charleston, West Virginia. So I'm wondering what you're going to do in response to what the other states are doing.
Mark, I'm going to continue to keep everything on the table and do and monitor this in every way. I would caution again our border counties, as we've done over and over and over, that they should be, completely on guard. There are people across our state that said, well, I don't think we should do anything. I think we should be South Dakota and everything. We did the smallest thing you could possibly do. Ask everybody to wear their mask in public buildings without shutting anything down, without closing, without restricting hours, without doing anything else. And you saw the uprising that we got, and it was fueled by people that were wannabes, people that are taking these good people's monies, and being wannabes. At the end of the day, Mark, I don't know where this is going to go. Nobody knows where this is going to go. As things get worse, we're going to have to do more. If things get better, we absolutely, or we can maintain, we absolutely don't want to do more. Because with more, there are circumstances and there's problems as well. And you know it. You know it. you can come up with, and I love your question, Mark, but you can come up with a million different what ifs. You know, right now, we keep all the what ifs on the table, and we keep moving forward. And we keep doing it to the very best of our abilities with the experts, you know, weighing in every day, all day.
All right, thank you, Mark. Next to David Beard with the Dominion Post.
Hi, I'm going to pass along a question from some people who contacted me, and I think the answer will be fairly simple. They go to gyms to work out, and they want to comply with the updated mask order, but they're not clear on it, and they're not getting consistent answers from the gym managers. They're unsure. Before the updated order, they could take their mask off when they were working out, and have it on when they walked across the gym and went in and out. Now they're not sure if they still have to keep the mask on while they're working out, or if they're allowed to take it off. If you could clarify that for them, thanks.
Well, David, I'm not an expert in this, and and our medical people could probably weigh in. You know, Dr. Amjad maybe, and Dr. Marsh, Clay especially. But I think when they go inside now, they should keep their mask on, even in physical activity and everything. And they have got to be able to maintain some level of social distancing as well. But at the same time, I surely understand, how difficult it is to breathe and everything else with the mask on, and some gyms are putting up plastic shields and other things to be able to separate people. But Dr. Marsh, I'm not your real expert on that. Dr. Marsh, maybe you can weigh in a little bit there.
Thank you, Governor. David, as I think you are insinuating, the executive order is to have people wear masks indoors at all times, and that should include gyms. If people can't breathe during physical exertion, then they should reduce that physical exertion or go outside and physically separate from other people to do that level of physical exertion.
All right, thank you, David. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. A question for Secretary Crouch. I have a friend in Tucker County, West Virginia, recently tested positive, isolating at home. And they say they get a call from the health department every day checking on their well-being. Is that normal, or is that just because Tucker County is a small county and they have a relatively small number of cases? And maybe go on from that and give me an idea of, once somebody tests positive for COVID-19, what is your department's follow-up to make sure that they're doing okay?
Thank you, Paul. That is normal. That's part of the responsibilities of the local health department. It's also part of the responsibilities we're looking at in terms of continuation of that as we ramp up in the number of cases we have in West Virginia. Certainly following positive cases is important that have symptoms. Following cases that are asymptomatic is not seen as that critical. So we're looking at that as a policy change, in addition to a few other things that we're looking at to try to ease the burden on local health departments out there. They do a terrific job, but having to call a large number of people daily is time consuming, as you might imagine. So individuals are self-quarantined and they're moved to recovered, as we've talked about, after 14 days. We're also looking at automating that process, and right now are moving those individuals to recovered after 30 days so that we take some of that burden off of the local health department. So, but you're right, that is being done not only in Tucker County, but in other counties, but we are looking at a policy change there. So it's a good question.
All right, thank you, Paul. Next to Steve Adams with Ogden Newspapers.
Hello, Steve Adams of Ogden Newspapers here. We talked a little bit about hospitalizations. It sounds like, from what I'm hearing today, that so far you're not too concerned about us going past capacity in beds, though I'm sure ICU beds are getting a little scarce. But I know, at least previously, we had talked about standing up either part of St. Francis or part of Fairmont Regional for surge capacity in the instance that we have a situation where we need some ICU beds. So I was curious to know if we still have those agreements on the table, and if we're still talking to those entities, and if that is still a possibility. Thank you.
Okay, Bill, why don't you answer the question about St. Francis and Fairmont, and then we'll fall back on Dr. Marsh or General Hoyer on the rest.
Yes, sir, Governor. Those agreements have been renewed. They're definitely in place. In fact, with regard to St. Francis, we are currently staffed for 30 beds. We can go up to 60 beds. If we had to go up a little higher, we could even do that. But we're preparing and have been preparing for a surge. St. Francis had communications with Dan Lawford this morning about St. Francis. With regard to Fairmont, that's a secondary backup surge hospital for Northern West Virginia. WVU and the WVU system is also prepared for a surge. We've had constant communication with them, as well as our larger tertiary hospitals in Huntington and in Charleston. So we're focused on this and trying to make sure we're prepared, but those agreements are in place, we're renewed, and we're prepared at this point for whatever happens. So thank you for the question.
And maybe I'll start, Jim, with the other part of the question. The issue about ICU beds and hospital beds, as you rightly indicated, we are seeing more activity and more people hospitalized with COVID in our hospital acute care beds, as well as our ICU beds. And we, as Secretary Crouch indicated, are in constant communication with the Hospital Association and with the major hospital systems in the state. And we have every confidence that the hospitals are managing responsibly. And from the initial round that we had with COVID-19, we learned many important lessons in how to create more capacity. I think it's really important for us to recognize the two sides of this equation related to hospital capacity, actually three sides of this equation for hospital capacity with COVID. So number one is we want to make sure that we are maintaining sufficient bed space in our higher level, higher acuity hospitals, our tertiary and quaternary hospitals, which include WVU Medicine, particularly Ruby, Mine Health, CAMC, Mountain Health, so that we don't overload those hospitals that can take care of our sickest citizens. Second thing is we have to protect our staff, because we know that opening beds without the expert caregivers is not nearly as effective. And so, our caregivers work in the same communities that we all live in. And so trying to help them avoid getting infected with COVID, not in the hospital during their work hours, but as they go home. And this is not trying to become Big Brother. This is really just trying to support people to make sure that we keep them safe, like we want to keep every West Virginian safe. And the third issue is we do have capacity across other parts of our healthcare system in the state, and particularly some of our additional hospitals are federally acute care sort of community hospitals that could be used to offset some of the less severely sick people, as Secretary Crouch said, St. Francis, for people who are COVID positive who may not have the same acute care needs that we would see in other of our acute hospital settings. So we're really looking at all those avenues and planning in advance. Right now, we are not in any kind of capacity crisis, although there are a lot of people in the hospitals, mostly not COVID positive, getting the needed care that they need that really occurred from the backup of the initial sort of reduction in activity that we did when COVID first hit us. Jim, you want to add anything else?
No, Governor, I think they've covered it well, and we continue to monitor it at least twice a day with the hospitals.
All right, thank you, Stephen. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to stay on the topic of our hospital capacity. I know with all the different avenues and options Dr. Marsh just discussed, we have lots of things across the state. Can we actually put a percentage on where we are currently at capacity-wise, what the modeling tells us we're going to be looking at in a couple of weeks, and where the actual, kind of red line is? What number do we need to start being concerned about that capacity? I know you said we're good now, but I'm just trying to think ahead a little bit.
Charles, let me make one little comment, and then I'm going to pass to General Hoyer because he can give you the specifics better than I. The reality is just this, is all of us watched, did we not? And that's why I say that we've all got to speak up. But all of us watched as we saw refrigerator trucks brought into New York City and all kinds of different places, to where, whether it be Florida or Alabama or wherever it may be, Arizona, where they ran out of capacities and everything. And and God forbid, that is the very, very, very last thing that we can do here because of our age of our people. We're watching it. We're really watching it. To say that we're not concerned with that at all, I don't think anybody would sit here and say that they're not concerned. It hadn't really even gotten bad cold yet. We haven't really had terrible weather, to where we basically are having to stay inside, in all kinds of different places. We absolutely should all, as great West Virginians, be concerned. Now, General, you can tell them that we know our capacities, we're nowhere close to our capacities at this time. But General, if you could add to that, please.
Yes, sir, Governor. So we, working with the Hospital Association, the experts in DHHR that work this, the specific hospital CEOs, we have set a statewide benchmark related to ICU beds, ventilators, and overall hospital capacity that's at 85%. Now, within that, we also work with those facilities as well as the Hospital Association, a balanced load across hospitals, because individual hospitals may normally be without COVID right at those numbers on a regular basis. And as Clay pointed out, and the governor, this time of year, we see ICU and other capacities within hospitals at normally 85% or in some cases higher, depending on the facilities. So it's a balancing act across the system. One of the things that the governor directed us to do is to have regular communication with facilities. So each week, Secretary Crouch, Dr. Marsh, myself are on a call with the senior hospital leaders as well as the Hospital Association to look at issues from PPE to balancing load across hospitals. And as Clay pointed out, in some cases, we'll also have to look at balancing across hospitals for individuals who are not acute patients. So it is an area that the governor's directed us to stay on top of. One of the two top priorities he's given us is to make sure that we keep our hospital system in solid condition, as well as working hard to protect our nursing homes, and we have regular communication with both.
All right, thank you, Charles. Next to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Dave Mistich, West Virginia Public Broadcasting. I'm not sure if this is a question for you or Dr. Marsh or Dr. Amjad or Secretary Crouch, but my question is it seems like you are articulating that another shutdown is not on the table right now. But then again, you offered some pretty dire and grim possibilities if we were to hit, hundreds of deaths a day. My question is, is if you in this administration could articulate some threshold that would bring about a shutdown, that would bring about more drastic measures in trying to quell this. Like you just mentioned, we're moving into the colder months and where people are going to be staying home anyway. Is there some formula, some threshold, some number that you guys are looking at where you have to pull the trigger, so to speak, on going that route?
Dave, let me just answer it as best I can. David, I think that answer is more no than yes, from the standpoint of this is an ongoing fluid situation, as I've said 1,000 times. There is constant input that's coming from all the medical community, all the education community, the National Guard, hospitals all across this nation, the presidency. There's information flowing in everywhere all the time. Now, from the standpoint of there being a benchmark that says, West Virginia, if you start losing 123 people a day, you're going to have to shut down, the hair and nail salons. There is not that, and there shouldn't be that. So with all of that, what you've got is just this. You've got, first of all, a request on the table that everybody wear a mask when you're in a public building. That's the first thing. The second thing is you've got a governor that's saying, from an economic standpoint, from a wellness standpoint, from an absolute spiritual and mental standpoint and everything, and an economic standpoint, nobody wants to shut anything down, especially me. We don't have to shut anything down today. We've got to absolutely just keep on trying to do everything we're doing. But we can't have a food fight over something as simple as this egg-sucking mask. That's all there is to it. We can't have a food fight over this. I mean, sure, it's an inconvenience. I don't like it either. But for crying out loud, we don't need a food fight over something to where somebody is standing up on a soapbox trying to get you to believe that if they make you wear a mask, they're going to take your guns, they're going to absolutely come and invade your house. I mean, really? Do you really believe such a thing as that? And so with all that, if we'll wear these masks, and by the grace of God above, we won't have to shut anything down. But Dave, it is every single bit of this has to be on the table, and we've got to be working with all the different blocks and continue to try to keep putting it together. It's hard to argue with what we've done thus far. Thus far, it's been pretty dadgum good, and I give all the credit to the great experts that are advising me each and every day. So let's just keep it moving and keep it moving in as good a way as we possibly can.
All right, thank you, Dave. Next to Joe Severino with the Charleston Gazette-Mail.
Hi, everyone. For the health experts here, since the COVID vaccine, early research is showing that it's going to be needed to be stored at a temperature near 90 below zero, where does West Virginia stand right now in terms of distributing a vaccine like that? And what steps are we going to be taking now to ensure that we're ready to distribute that vaccine when it gets here? Thank you.
Now, this one is you, General Hoyer. Go. This is right in your wheelhouse.
All right, Governor. So DHHR with the National Guard and CDC has actually been meeting this week, reviewing the plan put together by the DHHR staff in conjunction with the National Guard. There are 20 organizations already involved in that planning process. And I say organizations as opposed to agencies because they're entities beyond state government. They include all the way from the security police's part with the state police to the freezers that you talk about. There are freezers that have been identified in existing facilities. There are additional freezers on order. excuse me, and there are plans in place to be able to move the vaccines that require that low temperature. There's also discussion going on related to vaccines that will not require that low temperature. So a significant amount of work going on right now, as well as a plan to look across phasing in for healthcare workers, nursing home facilities, and all the things that have to be done related to prioritization. That gets briefed regularly and then is over reviewed by the governor.
All right, thank you, Joe. Governor, I'll turn it back to you.
Okay, you know, I hope we've clarified a few points here today, and again, I thank all the great West Virginians out there, everybody from our legislators to our media to everybody that's surely weighing in and trying to do all they possibly can to try to help this. I want to say just this, you know, I try to take notes as we go. You know, a question was brought up in regard to almost from an amazement, you know, that we are contacting people every day from our local health departments in regard to how they're doing and everything, and checking in on them and everything. And it was brought up in regard to Tucker County, because in Tucker County, you know, we may not have nearly as many cases and on and on and on. You know, I'm sure that we dropped the ball somewhere at some point in time, but man, are these people doing good work. And, you know, they need to be commended and thanked in every way. And so to all the health departments and all the DHHR and all those that are out there putting in these licks, thank you from me and from all of us, because it is amazing, you know, just what great work you're doing. You know, from the standpoint of St. Francis and Fairmont, you know, we made a plan. We made a plan early. Fairmont was surely getting ready to shut down, period. And really what's happened there is we saved that place. We saved that hospital, we saved those jobs, and we saved the ability for people in that community to go to that hospital and not have to drive all over Kingdom Come. In addition to that, we have the backup in that facility to go to a surge hospital if we need it. You know, people have made a lot of good moves on the chessboard, and I give them so much credit and so much thanks. I'll end by just saying just one thing, and that is, West Virginia, if you will continue together to pull the rope together, and we will not get divided and not off on one of these, you know, silly tangents. If we will continue to pull the rope together, we will get through this, and we'll get through this without shutting anything down. We'll get through this in a way, West Virginia, that all of us will feel very, very, very proud. We've still got rough seas in front of us. Don't think that we shouldn't be concerned. Everyone here is on high alert, and everyone here is working around the clock. Thank you a bunch. Keep together, West Virginia.